Right, looks like we have all the folks on the line whenever you are ready.
Great. Thank you, Miles. Really appreciate it. And thank you all for joining us on September 30th here, the last session of this month. I can't believe we're almost 7 months into this pandemic, but things continue to progress. So let me start, like we always start, with the numbers. I'm sorry to report we got 6 new deaths, and we've hit the milestone of 150 deaths in this county related to COVID-19. We're almost at 10,000 positive cases at 9,990, and that reflects up 41 from Tuesday, 36 from Monday and Sunday. Miles, are you able to bring up the chart there? As we try to bring that up. Some of the areas that continue to be of concern for us are really around the numbers surrounding that age group 20 to 29. You can see that they continue to lead the way in positive cases, and we will in the future be focusing our message there. Obviously, as you look to the next side there, you can see the cases by race, ethnicity. I'm sorry, we can go back one more time. The case by race and ethnicity there is really very perplexing and something that we are very much focused on. The R naught's good, under 1 is good. If we can go on to the next slide, we can see the hospitalizations are very good right now with the 30 confirmed. We got 0 from out of county. We got lots of capacity in the ICU and our regular beds. Go ahead. This is the next slide. Well, it's just staggering to think that we've almost tested 170,000 people. The positivity rate's way better than it's showing here, according to the state. We'll talk about that in a minute also. And the average daily turnaround is doing very well. You can see the cases by city. You can see also the long-term care facilities, the hospitalizations and the deaths are, still make up over half, but are getting better and are somewhat stabilized, and that's great. And I certainly attribute that to all the great work our health folks are doing. On to a couple of new things. One, I just wanted to let you all know that we will be starting a COVID-19 enforcement task force, and this is related to the opening of businesses. We wanted, and this is for a couple of reasons. One, we want to make sure that these businesses open as we open more and we move through these tiers in a safe and strategic manner. And there's guidelines in place that must be adhered to in order for us to stay open and keep progressing as a society. It's in the best interest of the businesses to do this, and we don't want people advancing too far out in front. If restaurants can only accommodate 25% indoors, we want to make sure that they accommodate only 25 and not move to 50 or 75%. If seating's not 6 feet apart, we want to make sure that we take a look at that. If the wait staff is not wearing masks, we want to make sure that we address that. The same thing goes for our retail stores and all other brick and mortar establishments that are opening now. We will put this task force together, and this is a county task force that will be working with the cities to make sure that there's a way for people to report this through a system of reporting, that there is follow-up, and that we work with the businesses, as some businesses may not know what they should be doing, and we want to make sure that we act as a resource for them too, to make sure that they have the information necessary to operate safely. We want to instill a level of confidence in the consumer that wherever they're shopping or dining or worshiping, that there are safeguards in place, and that people are adhering to, the owners are adhering to these safeguards. So we will continue to report out on that. We are in the stage right now of putting that task force and that program together, and we will update you on that. We expect it to be an opportunity for the public to interact with us, tell us places, and for us to make sure that we inform folks informally. Maybe it's a letter at first, but this will also involve county council, who will impose civil penalties, as well as the district attorney's office, who will impose criminal penalties for those repeat violators or for those who are so egregious that they're endangering the health of the public. So again, this is a county effort that'll be working collaboratively throughout the county with the cities. So with that, I'll talk a little bit about, let me just bring up the next area here. Testing for COVID-19 is available for everyone who lives in and works in the county of San Mateo, regardless of symptoms. We have recently, as we reported last week, increased the capacity to 5,000 tests more per week. New appointments locations are now available. This coming week, the county will hold its first full week of stationary testing at the event center. We started Saturday. We had less of a crowd than we had hoped for, quite frankly. We had room for 1,000. I think we only got about half of that. And we want to make sure that we use every single available opportunity to get people tested, and that every appointment is filled. That is from 8 p.m. on Tuesday through Saturdays, 8 a.m. to 3 p.m. And that'll continue for further notice. So that'll be at the event center in a stationary location. And then the schedule for the mobile testing sites, Project Baseline, which runs from 9 a.m. to 4 p.m., is on the county testing site. And we'll update that. So, we need to make sure that we get that a little bit user-friendly, and we're working on that. But we're pleased to report that the mobile testing site will be in Daly City, Half Moon Bay, San Bruno, and North Fair Oaks. These have been proven areas where we get a lot of testing, and that's not the only testing we're doing. Remember, we're doing the neighborhood testing on an ad-needed basis, and certainly we're doing the congregate care living residential living facilities on an ad-needed basis also. So a lot of testing, a lot of ability to test out there. Excuse me. And just a big thank you to the cities that have hosted the neighborhood testing sites, and there's 3 of them. East Palo Alto, San Mateo, and Redwood City. We can go in, we have the ability. I think there was one conducted at the King Center recently by the city of San Mateo. We go in there, train, and San Mateo used their own resources to conduct that event. So that is terrific. And it's just, so important that we have other cities avail themselves of this service. We're so grateful for those that have stepped up so far. And it's really a great example of how we all collaborate during this crisis. And we have a long and illustrious history here in this county of collaborating together and getting things done. And this is a great example of that in the neighborhoods. In regard to the blueprint for a safer economy, the county metrics as of Tuesday, we're looking good. And this, again, remember, it's a 7-day lag that we're looking at. But on the reporting yesterday, the county was down to down to an adjusted case rate of 6 per 100K. That is great, as opposed to 6.6 adjusted for that 9/29 on 9/29. Excuse me. That was the previous week. I'm sorry, the 6.6. And then the unadjusted case rate of 6.5 or 6.8 for the previous week. Our positivity rate is at 3.7 versus 4.5 on 9/22. So we're heading in the right direction on all of those. And we want to continue to trend down on those adjusted case rates. And obviously that's going to be up. And that's why we're putting all these other infrastructures in place that COVID-19 enforcement task force, the putting of the more testing in place, all those things, the educational component, all those things are so important, and they all work together to bring down the case rate and the positivity rate. So in San Mateo County, California, and the nation, metrics show that the greatest disparities are percentage of cases by race, ethnicity, and showing people of color have been most impacted by COVID-19. We all know that. The greatest over representation we have had in COVID-19 cases is the Latinx population, who are 51% of our cases to date, and yet 21% of our SMC population. And Chief Rogers went over a lot of this yesterday, but for those of you who may have missed it, and this is why I was talking about the other group, is that 20 to 29, our largest positive age group to date, with 1,897 cases. That represents 20.4 of our total cases. So 1/5 of our cases, yet they make up a mere 6% of the population. So we definitely got to get the message out to them. We also see that high positivity rate in the young adult age group as well in the Latinx, and is not reflected in the highest rates of death, which is the white population, but nonetheless, it's spreading in that age group, and we've got to make sure that we take aim at that and get the message out to those that we've got to stop with the gatherings that we're seeing, and we understand certainly that young people want to gather, but this is a moment in time that we're asking them to adhere to those precautions. Let's get through this so we can open up more businesses. The sooner we can get these numbers under control, the more that will open, and the more interaction they'll be able to have in a safe manner. So we all know a lot of these drivers in these communities are long-standing and deep. It really has to do with poverty. It's not going to be eliminated overnight, but we can certainly focus on that. And that's what Ms. Rogers was talking about yesterday: the low wages, the lack of paid leave. Those type of things have been really adding to those folks who may be sick and maybe even asymptomatic, but know they're sick, going to work and infecting others. So we have put in place certainly a relief fund, a financial relief fund, the rental assistance fund, the child care, the food insecurity, the Wi-Fi access, and the economic recovery. All those things will play a major part in how we address these disparities and making sure that those folks who are positive and in need of isolation have a place to go and know that their families will be taken care of with groceries, and that they will be taken care of by obtaining wages through the county. This is a major factor in the way that we feel that we're going to be able to get this disease under control in some of those populations that have been hit certainly more than others. Okay, so the new guidelines for playgrounds and Halloween are out. I think that we can certainly send that out to you. For the playgrounds, we've had a lot of questions about the playgrounds, the use of face coverings over the mouth and nose for everyone 2 years old and above, and it must be supervised by a caregiver at all times. Caregivers must monitor to keep adults and children from different households at least 6 feet apart. And certainly the washing and sanitizing of hands after using the playground is absolutely paramount in making sure that we do this in a safe way. And some of the requirements for the facility operators are to make sure that there's 6 feet of distancing between children and adults, and the use of play structures or play areas, and families wanting to enter the playground, making sure that they are distanced apart. Increased cleaning and frequently touched surfaces will be up to those who operate the playground, and to the greatest extent possible, provide hand washing stations at those facilities. So the numbers around the county: 11 guests at the AHS in Redwood City with 7 rooms occupied. The AHS in South San Francisco, 5 guests, 5 rooms. The AHS Bayfront Station has 94 guests with 84 rooms. And then around the county, we have additional 95 guests with 87 rooms. And we do have a wait list that's grown a little bit to 45. And we try to work diligently to get those numbers down, but there's a never-ending need for places for folks. So we are trying to work our way through that. The Great Plates program is doing fantastic. We're at over 2,800 participants delivered over, let's see, 630,000 almost meals delivered, 68 active restaurants. And as of today, we do know that the program will continue through October 9th. We will pick it up after that, if it does not, through the end of the month, to provide more of a soft landing. And then some of the COVID-19 investments today in the relief fund at the request of the board. As you know, the county staff have developed a very useful infographic. I don't know, can you pull that up, Miles? I think it's just fantastic. Do you have the ability to pull that up right now and show it to everyone? To date, the board has committed $16.6 million. I love this infographic because I think it's just so visual and tells us what we're doing. 16 to the recovery programs, which have been leveraged into $33 million collectively. The county, city, state, federal, and private donations for programs have topped over $50.5 million. just amazing, and more to come on that, believe me. Just a quick update on Census 2020. We're at 7.8%, 78.1% right now. And we don't know what will happen. There's been a signal by the Commerce Secretary, Wilbur Ross, that they will end the census on October 5th. I don't know how they can do that when there's a court order in place. This is going back to court, and we'll see what happens. But we're trying to get every last person registered possible, so please help us amplify that message. And then on the mobile mask mobile last week, 463 masks were distributed. To date, the team has distributed over 5,900 masks countywide, and there's a schedule that we'll give out to everyone in regard to the mobile mask calendar. So with that, kind of a brief, quick update. The real news is that we'll be focusing our efforts now on a COVID-19 enforcement task force to make sure that everyone complies, every business complies and adheres to the requirements as set forth. With that, Miles, want me to open it up and see if there's any questions?
If you have any questions, we don't have any written in, but if anyone here has questions, to please raise their hand and we can get to them. Well, I've got Sierra's hand raised right now. So Sierra Lopez, please unmute yourself.
Yes, how are you?
I'm good. How are you?
Good, thanks.
Good. I have a few questions, so I can go ahead and start. Let's see what comes from those.
Sure.
There's concern that the Project Room Keys program is potentially running out of funding. Is this a valid concern? And how does the county intend to continue the program, if so?
Well, you know, Project Room Key, we know at some point in time is going to run out of money, and I don't know when that will be. I'm not sure anybody knows when that'll be. And, you know, it certainly does play a major part in what we're doing with our homeless population now. But we know that this won't last forever. We've got to figure out a way to make sure that we house these folks. We are looking, it's no secret, we are looking for more stabilized housing in the form of a motel someplace. We're looking at opportunities to expand our homeless shelter on the land we're at right now with various new, more modular pieces of shelter that would allow for social distancing. So we're looking at and exploring those opportunities right now. But at some point in time, we know that it will be, or the use of CARES funds as they're scheduled now to you know, you got to use them by the end of the year right now. We got to figure out what to do going forward after that.
I have a few more, so is it okay to just continue or let someone else go through? Yeah. When it comes to the playgrounds opening up, do officials have any, you know, thoughts behind what the potential outcome might be virus-wise and spreading the virus? Is there any concern? What's kind of the county stance on that decision?
Well, I'll give my opinion, and then I'll turn it over to Sarija. I think that certainly the state wouldn't have done this unless they felt like anything else that they open up, that it could be done in a safe manner if everyone adheres to the safeguards that are in place. So certainly they've set standards out that should be adhered to. And if people follow that, we believe that the spread certainly can be mitigated and even eliminated if folks are washing their hands before and after. If they're socially distancing, they're not putting their hands in their mouth after touching or their face or eyes or whatever. And that there is active supervision of this to make sure that there is a spread between adults and kids and kids and kids, and that folks are wearing face masks out there too, for those that are two and older. So I think that there is a safe way to do it, and we're going to have to rely on those safeguards to carry us through in the future, no matter what we open up. And Sarija, I don't know if you have more to add there as far as the safeguards.
I would just add that the health officer has relayed that he's hopeful that reasonable precautions can enable kids to have access to outdoor play areas you know, it does require the continued vigilance for every family around the measures Mike reinforced. But we also know that exposure to the outdoors is important for healthy development. So we appreciate the measures that cities are taking as they consider whether playgrounds could be open.
Is there other questions?
Yeah, one more question. So yesterday, County Health Officer Louise Rogers mentioned that the state is planning on releasing additional guidelines on addressing disparities within communities of color. Is there any other word on when those guidelines might be released and what they might cover?
It looks like she's signing out.
Srija, do you have an answer to that?
I believe that there could be details released as early as later today. I don't believe that further details had been relayed as of the time of the beginning of this call. And from the dialogue with the local health officers, we understand that the metric will look at neighborhoods or census tracts or communities that have had greater burdens and exposure, less opportunities, to make sure that as counties mitigate the virus, that the counties that have had them, or the communities that have borne the most exposure, aren't left behind.
Great. Sarah, anything else?
Yeah, I guess to get back to your main news about this task force to address potential violators, is there any information on when this task force might be completed and put together, and when we can kind of see it being actually put into action, and what that'll look like?
We hope to have more announcements on that in the next few weeks. We will try to put it in place as quickly as possible. I don't have an exact date and time, and you know, I don't want it to sound like it's just going to be enforcement, but it'll also be education. I mean, some of these are confusing times for a lot of business owners, and a lot of business owners don't really understand to the full extent of what precautions they need to put in place. There's a lot of questions about a lot of businesses. So we want to be an educational arm too, but we also want to be a resource for the public. And I think it's absolutely imperative that the public feel that you know, they can go to a place and that they're going to be safe, in the sense that as safe as you can be around around people, in the sense that at least all the precautions that the state has required for this business to open are being adhered to, and that we have a mechanism to follow up on that and make sure that they are adhering to those procedures. So, and that there's a reporting mechanism in place. So, and the fact is that we will contact people who are said to be in violation or reported to be in violation, and we will follow up with them. And at first will be a notification that, hey, it's been reported, and then we'll go out there and observe, and if they keep, and they may be cited, and if they keep violating, they could be prosecuted. So we hope to get it up in the next couple of weeks, or have more information in the next couple of weeks, but a lot of moving parts here on the procedures. We want to make sure that we do it right. We want to make sure there's no confusion around it. And we want to make sure that businesses know that this is an opportunity for them a resource for them to really understand what's required of them.
I don't see any additional hands or written submitted questions. Do one last round, but right now, seeing none, that looks like it.
Great. Thank you, everyone. I really appreciate you being on today. Stay safe, stay healthy, and we'll be back next week. Take care.
Thanks.